Researchers are starting to understand some of the long-term effects of COVID-19, and some of that research is happening right here in Grand Rapids. 13 on Your Side health reporter Elena Holland is here to tell us about one of their latest discoveries. Elena.
Hi, Juliet. About 10% of lung transplants nationwide are going to COVID-19 patients. That's according to the United Network for Organ Sharing, or UNOS. But why? Michigan State University researchers and Corewell Health doctors think it may be linked to a specific gene. Researching the effects of COVID-19
is an adventure.
Xiaopeng Li, an associate professor at Michigan State University College of Human Medicine. He's researching explant lungs from patients who had COVID-19 infections. Later in life, those lungs became fibrotic.
There's a gene called ATP12A. It's upregulated in the post-COVID lung fibrosis patient.
The gene, he says, can cause mucus to build up in the lung. This can cause pulmonary fibrosis or severe scarring in the lungs, and it seems to be overactive in patients who had COVID-19.
Post-COVID effect to the lung health is still actively investigating, even though the pandemic is over.
So we think it's an exciting discovery and has some realistic therapeutic impact.
That's Retta Gerges, the medical director of the lung transplant program at Corewell Health.
We take care of a lot of patients with advanced pulmonary fibrosis and other advanced diseases.
He's hoping the gene discovery can reduce scarring and improve clinical outcomes for his patients.
That's our ultimate vision here, is that we're going to be able to develop a therapy that can attenuate their disease and perhaps either delay or prevent the need for a lung transplant.
The next step in research is to find out how the gene becomes elevated to find future treatments.
The disease is complicated, and we find this gene could play a role in this process.
MSU and Corewell Health collaborated with researchers from Cleveland Clinic. The study was published in the American Journal of Respiratory Cell and Molecular Biology.
Thank you, Elena.